Hey everybody, today's video we are going over degenerative disc disease for the 40-year-olds, those that think that it may be really soon for that to be happening to them. We're going to answer what is degenerative disc disease. We're going to go over does it get worse with age, and then in the very end we're going to do 2 exercises that can really help with those of you that are suffering from degenerative disc disease, okay? My name is Dr. Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa. If you guys want to know more about these things that we're talking about, just go to our channel, type in the search engine there, whatever you got going on. I promise you we have a video for it. Take advantage of those free resources, okay? So we're going to get into it. Let's describe degenerative disc disease first. For those of you in the 40-year-old range, you may have this idea of like, how is this happening to me so quickly? Is this something that I should be worried about? Should I worry about, going and aging later on in life? All of those kinds of things. So I'm going to describe it first and what exactly it is and some symptoms that come along with it, okay? Our little spine model back here, this is just the entire spine from the head to the pelvis here, and I'm going to take just one chunk of it in the very part of the low back. So these red vertebrae here are actually the low back, and we're just going to take a piece of those there, and we're going to bring it into this little model right here, okay? So the anatomy of the spine and what's important in degenerative disc disease is a couple of different things here, okay? First, we have the vertebra above and below, and right in between this white material is your disc, okay? It's like a jelly material. There's a bunch of fibers on the outside, some jelly in the middle. It's made up of some liquids, and it's really good for shock absorption. Okay, so it has the ability to move in different directions. We also have a spinal nerve here, and we have a joint called the facet joint back here that are really important. This, where the hole where the nerve is coming out, is called the IVF. Not super important, but it's important in what we're talking about as far as decreased disc height here, okay? So when we're talking about degenerative disc disease, the true simple just definition of it is the amount of white material you see here becomes shorter and shorter over time, okay? When we're talking about a disease process, this really truly isn't a disease. It's just a progressive process that occurs because of too much improper stress at a joint over time, okay? And when I say too much movement or improper stress, it's us trying to find too much movement in this area. Somewhere else isn't helping you. Too much stress here, all the liquids and all of the stuff that this disc is made up of starts to flow out, doesn't fill back up over time, and so we just have a little bit of a dried out disc here. So when the height of this disc starts to decrease a little bit, what happens is the IVF here, where the spinal nerve comes out, also starts to shrink, okay? So what can happen is you create a little tourniquet on the nerve here, and anything supplied by this nerve can become sharp and shooting, can become dull and achy, can sometimes have numbness and tingling. If we're talking about the lower part of the spine, usually that can create some sciatica type symptoms down the back of the leg into the foot. If it's a higher part of the spine, it can be kind of that groin pain, quad, sometimes knee pain, things of that sort, okay? Again, when the disc starts to shrink in size here, we also start to put some excessive stress on this joint back here. Usually it prevents a lot of extension, okay? So going backwards here. And when you ask a joint and bone to take on that much stress over time, what happens is it starts to grow more bone. And when it grows more bone, sometimes what happens is it starts to migrate again into that IVF. That's another way that we can get pressure onto that spinal nerve there, okay? Sometimes as far as imaging is, when we're talking about imaging, you may hear big, bad, scary words like osteophytes or facet hypertrophy. Those are just ways of saying that your bone is trying to grow almost like finger-like figures, trying to just grasp onto different areas of the spine to try to prevent that excessive improper movement in that area. So a lot of little nerdy things to go over there, but it's really important just to know the anatomy of what's going on back there, and just know that because it's called a disease, isn't really truly that scary. It's just kind of something that happens with the aging process and can be sped up when we're trying to find too much excessive movement through that area. So what we want to try to do is to try to prevent how much movement's going on in that area through building up stability around the spine, usually meaning things around the core, things around the glutes, things that just create stability at the low back area. So the next question then is, for those of you that are diagnosed at a young age, or you feel like it's at a young age, does it get worse over time? No, it does not have to. If we don't do anything about it, if we don't change anything about our lifestyle or the way that we're moving, then yes, it could continue to just progressively get worse the way it has been up until this point. I like to give this analogy of what's happening here and compare it to those of us that get knee injuries at a really young age, okay? So we use this analogy in the office sometimes. They're noticing with research and research over time that girls at 15 who get ACL injuries in their early 20s could have a degenerative joint that goes on at the knee there. And when we're talking about building up some proper support for the knee, well, when we think about it, what's the helper of the knee here? Well, usually the glutes and the hips above and something in the foot and stability below. So less stress in this area by shifting the load above and below. The same thing happens in the spine as well. So if you at a young age had an injury or didn't know better ways to move through the spine, then something above and below or around it needs to help prevent excessive improper movement in that area, slow down the process of what's happening, and that's how we start to deal with degenerative disc disease at a younger age. Is this something that can heal on its own? Not necessarily. The body doesn't just reverse this process. There are things out there that can help heal the joint, but you don't necessarily need that. If you're just looking for ways to mitigate pain, how to get rid of pain, how to move better, how to get back to your goals, things like Chiro PT, those who are really good in exercise and our movement specialists are the ones that can help you slow down this process and educate you about this, okay? So don't let the words degenerative disc disease make you fearful of what's going on with you. This can be a normal part of the aging process and it can be slowed down, okay? You can have the ability to manage this condition. So we're going to get into those two exercises now that we can start to dip our toes into how to change our movement patterns, how to build up that stability that we need. So I'm going to give you two exercises right now that you can try at home. If your body does not like it, obviously do not do it. Don't force yourself to do it. Nothing we do today should be painful. It should decrease pain, okay? So the first thing we'll get into is something some of you probably have tried or have dipped your toes in before, and it's a simple glute bridge. But how to pattern it is really important here, all right? A lot of times what happens in degenerative disc disease is we find weird movements through our spinal area. So what we want to try to work with is spine positioning first before then we ask the helpers, our glutes, to get us up into the glute bridge position, okay? So first and foremost, let's just take our hands to our hips here, and we're gonna get the feeling of what it feels like to create a tunnel for a little bug to crawl under between your back and the floor, and then how to squish the bug while it's crawling through that tunnel, okay? People will do this in a bunch of weird different ways. This should just be coming from the low back and the pelvis here, so rocking the belly button to the ceiling, and then belly button through the floor, and getting used to this movement, okay? What's important now is to keep the back squished to the ground here. We can even put a little bit of pressure through our heels to get that movement, and we're keeping that as we peel our spine up to the ceiling. If you're gonna lose this, or if we don't have this ability to differentiate spine and hips here, you're gonna see a lot of this at the top, and then you'll just feel low back happening all of a sudden. So starting from the beginning here, squish the bug, peel up to the ceiling. We're gonna feel glutes and core working here, no low back, and we're gonna keep that as we roll back down. If you guys got this pretty well, then we wanna take a little weight here. I got about 25 pounds, maybe grab something heavy at home. You'll feel a lot more belly working as we put this overhead, push it to the ceiling, and keep that there as we again peel up and peel back down. So you see what I'm doing here is shifting load away from the spine like we talked about. Improper movement in that area. We want to shift the load here above and to the hips below as we now learn how to properly stabilize the core, stabilize the spine, and go through this movement. I want you to find a challenging amount through this one. At no point should it be painful. Retest your discomfort afterwards and see if it helped at all, okay? So that's number one, learning to get the glutes and hips to move a little bit better and getting the spine to stay stable. So we're gonna take that and transfer it into a movement that looks more functional, getting up and off the floor, picking things up off the floor. It's a simple split squat, okay? I want for those of you who are a little bit fearful in trying this movement to maybe get a chair or be near a couch. And what we're gonna do is we're gonna just bring one foot forward and one is still behind us. We're at 90 degrees at the hips and at the knees here. And all we're doing is using a little bit of support here to see if we can drive the front heel through the floor to stand on up, okay? And then we're gonna let that heel pull us back down to the ground, all right? This is here for us if we feel wobbly in this, okay? Again, heel through the floor to stand tall, and heel pulls you back down. You should feel a little glutes, a little quad working, leg, no spine at all. What I don't want to see is all this weird dipping stuff, all of this kind of thing going on, because now we're just, again, promoting that improper movement through the spine. So what's super important is use the support if you need to. This is what it looks like from the side here. You can go hands on the bench, drive the heel, stand tall, and bring yourself back down. Maybe something a little higher might be better, okay? But all I want you to do is try to train yourself to feel our legs through this movement and not feel our back working in this at all. Switch legs, find a challenging amount, retest your discomfort afterwards and see how you feel. So those are two pretty challenging but simple exercises for you to start to differentiate spine, hips, and core. Again, slowing down the process of what's going on at the joint there, getting helpers to help, okay? If you guys like this video and you want to know a little bit more about what you can do, some extra exercises you can do, or if you want to know the steps to take to get better through this process, there might be a gift that pops up on the video. You can take advantage of that gift and it'll take you through the necessary steps. There probably is a link in the comment below as well. Click on that link and see what we have to offer for you. We can help you virtually or in person depending upon where you are in the world. All you have to do is reach out and we'd be happy to help.